Dr. Berger here from Northeast Medical Practice, our concierge-style medical practice located in Great Neck, New York, where we have weight management, full-spectrum primary care, as well as medical aesthetics. So just had a conversation with someone about the term longevity medicine. It's kind of a hot button topic, often mentioned in news, social media, etc. And people often think about it as, give me a pill that'll help me live for a really, really long time. Maybe the biblical 120 years or something like that. This is not how I approach it. I don't approach medicine in general as anything that can be done with a magic pill, because I think lifestyle with medication when needed is the foundation for a long, healthy life. And when I think of longevity medicine, I suppose you could say I'm practicing in that space. I'm not just saying let's live to 120 at all costs, regardless of what those later years are like in terms of health and debilitation and so on. So I think it's really important to essentially put money in the bank as early as we can in our lives with really good lifestyle. So that means lots of muscle mass when you're young, because everybody's muscle mass declines, and we still want to be able to perform all our daily activities when we get into our late years. Maintaining the physiologic condition of the body by controlling blood pressure, cholesterol, blood sugar, sleep apnea being treated and or resolved if weight loss is the cause of it. Basically screening really deeply and early for cancers, and often because the government regulations from the United States Preventive Services Task Force are really, really minimal and just basically designed to what can the medical system of the United States actually cover, not on what's important to screen for, which is why we do blood testing and whole body MRI for our patients and so forth. So to me, what's longevity medicine about? It's about maintaining good health for as many years as possible, putting off all of the things that ultimately take almost all of our lives regardless, heart disease and things of that nature, cancer, etc., which we can't prevent, but we can really postpone and decrease the likelihood of, and hopefully help our patients have much healthier later years so they can enjoy those so-called golden years and not be sick, debilitated, ill for 10 plus years at the end of their life, which is what conventional medicine in this country still does. It's gotten good at controlling chronic diseases like diabetes, high blood pressure, and so forth. However, it is not good at preventing them from happening in the first place or really postponing them for a very long time. And that's where the medicine that we practice in our concierge-style office comes in, because we have time to address these kinds of issues. Prevention takes a lot of time. Prevention is not reimbursed by the insurance companies well. So in a conventional practice where your physician sees 30 plus people per day, has maybe 7-8 minutes to speak to you, there's no way to get into all of the nuance and detail of preventing chronic disease and optimizing life, because all the social aspects of our lives, our family and our friends, our workplace, what we do for a living, what kind of schedule we have for our work impacts our lifestyle so heavily. And you need not just your doctor to have time to talk to you, but in our office we have a health coach, a well-being coach who is certified in that discipline. We have an exercise physiologist. We need many, many hands on deck to help our patients optimize their health. And that's the key to longevity. Longevity should not just be about lifespan, it should be about health span. Really high quality of life for as long as possible, and when the next world comes knocking, hopefully it's not a long period of sickness, and we can really enjoy those later years that are supposed to be the golden ones. So if you have interest in learning more about our concierge style practice, again, we're Northeast Medical Practice located in Great Neck, New York on Long Island, and you can reach the office at 516-604-3418, online at northeastmedicalpractice.com. You can check out my podcast on Spotify, which is called Longevity MD, where I talk with other physicians about how we can optimize our health health. And of course, everything I share here is for educational purposes only, and we have not formed a doctor-patient relationship at this time. And if you have specific questions or concerns about your health, please do reach out to your medical professionals without delay. However, until we see one another again, be in good health for a really long time.